Hello, welcome to Health Matters, coming to you live on Channels Television. I am Yomi Otaibi. Our conversation on the show today will be on that part of the body that has been described as the window through which individuals see the world. I'm talking about the eyes. We'll be highlighting all we need to know to ensure that our eyes continue to work optimally. A consultant ophthalmologist joins me in a moment for the details. Also, we have snippets of what's up on our health news segment. To stay with us on the program. You're right on time for Health Matters, and I've been joined in the studio by a consultant ophthalmologist at the Orile Agege General Hospital in Lagos, Dr. Atinoke Ajoloko. Thank you so much for being with us.
Thank you for having me.
Good to have you here.
Thank you, ma'am.
We're talking about care of the eyes, and I know this is your passion. This is what you've been doing. Just describe in one word for us. Okay, maybe not one word, what the eyes are. We all know.
The eye is a wonderful part of the body, and as we all know, it's the window to the soul. It's also a window to the body. It's an extension of the brain. It's part of the brain. So it's a very important part of the body, such that if anything happens to our eyes, about 50% of our self-esteem is gone. So the eye is an important structure we cannot joke with. So the health of the eye is very, very important.
And so we are not joking with it, and that's why we're having this discussion. So how do we care for our eyes? Where do we start from?
Well, the care of the eye starts from visiting the eye clinic to see an ophthalmologist. And whether you have eye complaint or you don't have eye complaint, it's important you decide to go and see the eye doctors, the ophthalmologist, to examine your eyes. Because there are some things that could be happening in the eye that you may not know, that wouldn't give symptoms until they get to the advanced stage. So it's very, very important you visit your ophthalmologist. And not only visiting, you listen to what the ophthalmologist is saying after examining your eyes. As in, you try to pay attention. If you don't understand, ask questions about your own eye. Then, whatever the advice the ophthalmology gives you, you go ahead and do so. So that is very, very important. Another very important way we can take care of our eyes is through our daily routine. We live in AC houses, air-conditioned rooms, air-conditioned cars, air-conditioned offices. And we remember that air conditioning...
I'm sure that doesn't represent all of us,
Okay, so
but
I just want to remind us that as we use our air conditions everywhere, we must remember to have humidifiers or living plants to increase the amount of moisture in the air. Because as we all know, air condition evaporates water from every surfaces, including the eyes. And for those that use system for a long period of time, they are on screen, it's very important that they remember to think and blink, because we ought to blink regularly in order to lubricate the eye surface.
I guess a lot of people will be on that table, we are all with our phones, our tablets, trying to get information. So we need to get away from it.
Blink, think and blink. At least every 20 minutes, just remember to think and blink. It's very important.
Why? Why is it important?
It's very important because the way God created our eyes, we need to blink. Like once every 20 minutes, blink. It helps to lubricate the eye surface with some...
Every 20 minutes or every 20 seconds?
Every 20 seconds, if you can. But how many people can remember to blink every 20 seconds?
I thought that comes naturally.
Well, with adaptation, there are some attitudes we acquire. And one of it is you can forget to blink, especially when you are glued to the screen. So it's very, very important to think and blink while working, especially on screen. It will lubricate the eye surfaces.
Aside from lubricating the eyes, what about the light from the screen? What effect can it have over time?
Yes, it's very important to also protect the eye from excessive light from the screen. So there are some glasses you can use while working on the screen for a long period of time, so in order to make your eye more comfortable. So,
and that's not just for the phone, perhaps for other people working in the offices that we use the desktop and the screen in the office.
Yes, every screen, every form of screen, be it laptop, desktop, phone, television. Yeah.
Okay, so you've talked about limiting screen time. Let's talk about protecting the eyes from sun rays.
Yes, part of the ray, we call it ultraviolet ray, infrared ray. There are some that are invisible, and those ones we need to protect our eyes from them. And you need to wear sunshade. When you are in the sun, it's very advisable to wear your sunshade.
It's not just for fashion.
No,
it's also for protecting the eyes.
It's not for fashion.
No, it can be for fashion, but it's a dual purpose.
Yes, yes. So you wear a face cap or your hat, because even the sun ray can burn your macula, the very important part of the eye that is very important for reading, for seeing. So you want to wear your sunshade, your hat, or your face cap when in the sun. So then apart from that, I would like to mention occupational hazards. People like welders, they need to wear their safety goggles, safety eye goggle while welding. Carpenters, while nailing, they need to wear their safety eye goggle. Artisans generally, always wear your safety eye goggle while in the factory or at your workplaces in order to protect your eyes.
Okay, so let's talk about some of those habits that some people may have in terms of if anything comes to the eye, the first thing is to try to put the finger or the whatever part of the finger in the eyes. Let's talk about those things that can affect the eyes that we do sometimes that we may not know.
Yes, first and foremost, I'll talk about hygiene. Hand hygiene is very, very important. Very important, because subconsciously you touch your eye, you touch your face with your hand, and your hand could have carried dirt everywhere. You put it in your eyes, you infect the eyes. Yes, that is, and you start coming down with symptoms of pain and eye discharge. So, but when you have hand hygiene, you wash your hand regularly with clean soap and water. So even if you had to touch your eyes or you feel like your eye is itching, you wouldn't be at much risk of infecting yourself. Or now, I also want to talk about nails. Keeping our nails too long, is not healthy for the eyes, because inadvertently you could touch your eye with it. Then apart from that,
to cause injury?
Yes,
you mean?
Yes, you could touch your eyes with it and injure your cornea. And we don't want anything to happen to the cornea. I can bet it with you. So it's very important to keep our nails at a good length. I won't say keep your nails short. Keep it at a good length and healthy length and hygienic. So, and apart from that, when you have itchy eyes, rather than poking it, scratching it, it's better you go to the ophthalmologist, go to the eye clinic and get it treated. Because apart from scratching,
first to know what is going on with the eyes.
Yes, know what is going on. And when you scratch your eyes, you develop red eye. Don't put
eye drops,
toxic things, not even eye drops. Abstain from harmful eye practices. You scratch your eyes, the eye becomes red. A neighbor advises you to put urine, or you put breast milk, engine oil, onion water.
I think I've heard that story for young, babies. They say, okay, so if something is coming out, then such practices are not good.
Adults, they put all sorts in the eye. Those are harmful practices that causes blindness. They cause blindness, irreversible blindness, both in children and adults. So, and we don't want anybody blind in our world, not in this age. So, I would advise anyone with itchy eye, please go to the ophthalmologist. It could be something small, but by the time it gets infected or something else happens to it in the process of scratching, it could be something big.
Now, let's talk about conjunctivitis. That's the one that, every redness in the eye. People say it's Apollo, or as in the local parlance. What are some of the reasons that the eyes can be reddish?
Yes, yes. There are several causes of red eye, from infection. An infection could be bacterial, viral, and the viral one is the popular Apollo. We call it adenoviral conjunctivitis. It could be, if someone is having red eye, it could be Apollo. And Apollo is a self-limiting condition which you can use antibiotics for to prevent maybe superimposed infection. But by the time you become agitated and you start putting all sorts, it becomes a big thing. So another thing that can cause red eye is subconjunctival hemorrhage. That could be from trauma, maybe something hit you in your eyes. It can be from systemic problem, like if you have hypertension and you rupture a small vessel in the eye. So, so a lot. So
now that you mentioned hypertension, so there are some conditions that one would need to take care of so that it doesn't move on to affecting other parts of the body, particularly now as we're talking about the eyes. You mentioned hypertension, diabetes too.
Yes, indeed, there are several conditions that can affect the body and would also affect the eye. And that is the more reason why the eye is called the window to the body. If you have diabetes, it can affect the eye. When your blood sugar is, even if diabetes has not affected your eyes, when your blood sugar is high, your vision is going to be blurry. But by the time your blood sugar is well controlled, your vision is going to improve. And diabetes as it is can cause several problems in the eye. So that is why it's very, very important for people with diabetes to visit their ophthalmologist at diagnosis and every 6 months, even when they don't have symptoms. It's very, very important because diabetes on its own can cause irreversible and very expensive blindness. So apart from diabetes, other disease conditions, there are so many.
So we need to take care of those conditions so that they won't, graduate into...
Yes, and when it's also very important to pick, if they have started affecting the eye, to pick it early in order to be able to save the eye, because those disease conditions are usually a progressive thing. Once it starts, it continues. It's a cascade.
Now, one other practice that some people have talked about is about glasses, lenses, and all of that. You find that some people will say, you know what, you can pick your lens or your eyeglasses by the man in that shop, without having to see, or some people sharing their glasses. What would you say about that?
In this age and time, I don't want to hear that you are sharing glasses with someone else as an ophthalmologist. They will tell you that,
oh, I can see well with your glasses, with your own kind of reading. So.
And I don't want to hear that you go to a roadside person to get your glasses, because glasses is a personal thing. You can't just have glasses without a test. You'll be tested. And the prescription you have depends on your body, your eye. Your eye is part of your body. It depends on your eye, what your eye needs. What my eye needs is different from what you need. It could be similar. So you can't share glasses with someone else. Otherwise, if you continue after a while, you may develop some unwanted symptoms like eye pain, which you wouldn't want. So, and it can also make you fall. If you wear a glasses prescription that is not yours, you make the mistake of walking around, you can fall. And you don't want that to happen to you. So it's better to go to the hospital, get your eye tested. In fact, before you collect glasses, let your eyes be examined in details. And when it's examined, if there's any other condition, you'll be informed, such that if you need to treat that condition while wearing your glasses, fine. Or you need to treat the condition before collecting the glasses.
Okay. When we come back, we'll talk a bit more about this, but for now, we have to go on a quick break. Do stay with us on Health Matters. Thanks for staying with us. We've been discussing care of the eyes, and you can join us in this conversation. You have your comments, you have your questions. The doctor is here to answer you. You can call 080 8054-2233 or on X at yomi_otaigbe or via email or mo.taigbe@channelstv.com. Doctor, thank you for staying with us. So before we went on that break, you were talking about the need for individuals not to share eyeglasses. One, you said we shouldn't go to roadside to get the glasses. We should get tested before
you get your glasses.
You get the glasses.
Yes.
Now, at what point do we need to change the glasses? Because some people say glasses do expire. Is it that glasses expire or perhaps the eye reading has changed?
Yes, it still goes back to your prescription. Prescription of glasses is individualized. For instance, if you are presbyopic and you are using a presbyopic correction, that is just for reading. Presbyopic correction, you may need to change it after 3 years because presbyopia, whether you use glasses or not, it will keep increasing until you get to 60 years when it becomes stabilized. So as you grow older...
Presbyopia meaning?
Inability to read.
Okay. Except
you use glasses because of the weakening of the high zones, the control mechanism that controls our reading ability. When we get to peri-40, it becomes weak. And it's going to be getting weaker, whether you use glasses or not, until you get to the age of 60 when it stabilizes. So when you collect glasses, after 3 to 5 years, you are likely to need a change of prescription. Not that the glasses is spoiling your eyes, like many people will tell you that, before I started using the glasses, my vision wasn't this poor. No, whether you use the glasses or not, it will keep increasing until you get to 60 years. So you really need to check to change the glasses. So you need to go back to your hospital and get tested again.
Okay, we have a caller, Charles from Abuja. Hello, thank you for joining us.
Hello.
Are you there? Go ahead with your question or comments, please. Thank you for joining us. Please go ahead.
Yes, ma'am. From my question is
a bit muffled. Maybe we'll try. You can try to reconnect again. Okay. Quickly, doctor, let's talk about diet. You know, I know it's an important part of healthy living. What does it do to the eye? What are those things that we can eat to help our vision?
Yes, that's very, very important because as obesity is not something we want to encourage, it's also discouraged because of the high health. So we need to eat right. We need to have the right nutrition, have the necessary micronutrients, multivitamins in our system. It also affects the health of the eye, especially the back of the eye, that is the retina. So we need to take adequate carrots, green leaves, green leafy vegetables like broccoli, cabbage, lettuce. We need all those, and we need them fresh, not when they are overeated or their nutrients we need them fresh when they are fresh. So we need tomatoes, we need all those nutrients in our diet, like every day.
Tomato, okay. Let's see. I think we have another caller, Lara from Lagos. Thank you for joining us. Oh, wow. I really can't get what you're saying. Maybe we'll need to check the connections, and you can also try to call in again. Quickly, let's be done with this diet part of it. You said carrots, lettuce, and all the green leafy vegetables.
Yes. tomatoes, onions, because all these contain micronutrients that are very, very important for the health of the eye. So they are very, very important. And we should also have multivitamins we take that would help our eye health. So especially as we grow older, we need them. Very, very important. So now let's come down to diet. It's very important to reduce carbohydrate intake and fat. Reduce carbohydrate intake, reduce fat intake, all in an effort to reduce weight. As in, try not to gain so much weight, because as we grow older, our metabolic rate reduces. And so as you accumulate, it affects blood flow and blood supply to the eye. And remember, the eye is part of what we call hand organs. And the blood flow to the hand organs are terminal. So we don't want anything that would compromise the blood flow to the eye, especially as we grow older. So we need to check our weight, check our diet, ensure we have balanced diet, adequate fruits and vegetables in our everyday meals.
What advice do you have for those who are smoking? Because I understand smoking also has its own effect on the eyes.
Smoking has a bad effect on every part of the body, especially the eye. Remember I said the eye is part of the brain. And there's what we call peripheral neuropathy that is generally associated with smoking. You don't want anything to affect the nerves. So the cornea, a very important part of the eye that is very essential for vision, can be affected by the effect of smoking, which we don't want. So I discourage smoking, and I know every ophthalmologist discourages smoking, like every neurologist would do.
And then sleep. Quickly, my director is telling me we need to go.
Sleeping is very, very important for the health of the body, health of the brain, and invariably the eye. So we need sleep. Sleep, you can't compromise sleep. Once you have sleep debt, you have to pay it. Otherwise, you can't be comfortable. Sleep is very important. You don't wait until you have stroke or your body breaks down before you think about sleeping. So no matter how busy we are, you have to look for a way to sleep and rest your body.
Thank you so much, Doctor, for coming on today on Health Matters. We've been having a chat with a consultant ophthalmologist with the Urine Agege General Hospital, Lagos, Dr. Atinoke Ajoloko. Thank you so much for being here.
Thank you so much. Thank you for having me.
Yes, and just one more thing before we go. We have stories for you on our news segment.
The federal government has reaffirmed its commitment to building a strong primary healthcare system while also ensuring that essential vaccines reach every Nigerian child. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pati, reiterated this during a meeting with officials from Gavi, the Vaccine Alliance, in Abuja. Professor Pate notes that despite challenges, significant progress has been made in the production of malaria and HPV vaccines in Nigeria in partnership with the global health stakeholders.
The base has been built, but it needs to be sustained and it needs to be resourced over time, technically, financially. On the government side, we've tried our best to continue to prioritize these issues, and that remains. And so in that context, your successful attempt at replenishment for Gavi 6.0.
The Lagos state government has asked health practitioners to embrace a future anchored on sustainable, inclusive, and resilient HIV interventions. At the 7th National Council on AIDS held in Lagos, the State Commissioner for Health, Professor Akin Abayomi, explains that the state has taken deliberate steps to localize the HIV response and has scaled up community-based testing, improved treatment linkages, introduction of innovations like HIV self-testing, and planned intensified prevention efforts among key populations, adolescents, and women.
As a country and as a state, we need to now take more ownership of HIV. We need to be responsible for managing the profile of HIV/AIDS in our respective environments. That means we need to make the cost of managing HIV cheaper, more accessible, and in a more integrated fashion.
Remember, caring for your eyes involves you prioritizing regular eye exams, protecting the eyes from sun and injury, and practicing good hygiene. That's Health Matters for this week. Thank you so much for being with us. I am Yomi Otaigbe.